some health posts there as well. And then, of course, the Syrian refugee crisis that has been going on for far too long. Lebanon, we work, Turkey, we work, and then directly in Syria as well. And then the third component is that we actually build healthcare infrastructure, and we help build healthcare system, like health systems. So as far as healthcare infrastructure, for example, in Sudan, we built the largest and the only oxygen generator in South Sudan that serves 7 million people. And this was during COVID time. So it was very, very much needed. And we've done the same sort of projects in Syria and things like that. So we help really invest in the countries that we serve. So I wanted to, use my 30 minutes or so to talk about the programs that Med Global does and how we incorporate education and training to whether it's refugees, whether it's to other healthcare professionals in the countries that we work in. And so I'll be shifting back and forth between those two. So as I said, Bangladesh is one of our biggest programs. And so everyone knows about the Rohingya refugee crisis back in 2017, when we saw those pictures of the hundreds of thousands of migrants that were crossing the border from Burma to Bangladesh because of the ongoing genocide that was happening in Burma. We started our program in 2018, and we operate 2 health posts in the Rohingya camp itself. And we've served over 150,000 refugees there. And Med Global was actually awarded one of the top 10 NGOs out of 175 NGOs that are working in the camp. So we provide adult and pediatric healthcare services. These are basic services for the refugee population. And what's interesting is a lot of people don't know this, that refugee populations, they end up dying from chronic diseases like diabetes and high blood pressure because they don't have access to healthcare, because they don't have access to their medications, the need for medication refills, things like that. So, our health post and the other health posts in this camp help provide those services. And then you're also dealing with a population of Rohingya that never saw a doctor in their whole life. And so this was the first time that either their children were being seen by us or they themselves were being treated for illnesses that they didn't know that they had, on top of all the trauma that they faced. So the physical wounds, and there were some very horrific stories that we heard, but the mental wounds, the traumatic wounds that we also helped heal as well. But it's really the chronic illnesses that people don't realize that's what seems to be the highest issue of mortality. I put in this picture of this young man with our president. So on the left, there is our president, Dr. Zahir Sahlul, and then with him is this man with these glasses. And it's a very touching story. This man came to our clinic, and we had an ophthalmologist that was treating patients at the time. And the ophthalmologist brought these self-adjusting glasses so that we could adjust the prescription on the glasses. And after she did the eye exam, she was able to give him these glasses and give him a prescription that he could actually finally see. And when he put on these glasses, he started to cry. And he said that, and this was very early on in the crisis, he said that when I came here, I lost my family. And because I couldn't see, I couldn't find them. And he's like, now that I have the ability to see, I can try to find my family. And so this is just one of, so many millions of stories and we were so grateful and touched by his story. Another person, who also got these glasses, it was also very emotional for him because he said, I could read the Quran for the first time, and which was, his faith book. And in times of crisis and in times like trauma, faith was so important to them. And because they couldn't see, because they had slightly blurry vision, doing something so small was able to change something so big. So it was, it's stories like these that really help us to keep going. So our 2 health posts are linked to a community health program. So we have people that go out within the community, and this camp is huge. It's like, as far as, when I went to the camp for the first time, as far as your eye can see, all you see is these, it's, it's, it's like these tents that are made of bamboo. So, not cloth tents, but bamboo, and then just tarp at the top. And as far as your eye can see, this is all you see. You can't see road, you can't see anything else. So you can literally get lost in these camps. So where we are, there's probably like hundreds of thousands of people. So even if since we've been there since 2018, and I don't think that we've even been able to reach, the majority of the population, although we've reached about 40,000 people with our community health program. And so what it went on to do was to teach about certain things like hygiene, identifying illness among families. So living in very crowded spaces, you can imagine how if one person gets sick, the whole family gets sick, their neighbors get sick, and everything is very close together. Psychosocial support was a big one. So we taught the community health workers basic psychological first aid, because of course, all these people went through significant trauma coming over. So that was really wonderful, and we were able to go to community members and the Rohingya to talk about how to deal with some of the mental health issues that they were facing. Water was also a big one. So when I was there was an E. coli outbreak in the water. They don't have access to fresh water. They don't have hand washing stations. They don't have, the water just comes out of these wells. And so how to identify clean water, how to know, signs and symptoms of how you've ingested bad water or bad anything for that matter, and then sanitation as well. So when I was there, they didn't have a sanitation system. This was a camp that was just being formed literally as people were walking across. So these are the first things that come to mind: is how do we deal with sanitation, waterborne disease, the importance of hand washing. How do you hand wash in a refugee camp when you don't have access to water? So there's so many things that we have to think about when we start programs like this. But our community health program has been very successful. And as I said, we've been able to reach out to about 40,000 people that were made aware of healthcare issues. And then when COVID-19 hit, we created a vaccination and awareness campaign for COVID-19. We were very concerned. Med Global as an organization was very concerned about all the refugee areas that we work in and all the displaced people that we work in, is that COVID will just fly through these camps like wildfire. So again, how do you socially distance in a camp? How do you hand wash in a camp? These were all big challenges, but we did offer a vaccination program, and then we were able to teach the local members of the community how to reduce burden of the disease. So we were able to create hand washing stations in different areas in the camp. We did provide education on the spread of COVID and protecting yourself. So we were able to give masks out, things like that. And then most importantly, like, what are signs of illness? So, if you have a child that suddenly starts crying too much and can't be consoled, what does what does a fever look like? Not just the heat part of it, but, you can have seizures with the fever and certain things like that. So, we were able to teach the refugees, again, signs of illness. In one of these pictures, you see them all putting their hands out. This is us trying to teach them, if someone is sick in your home, trying to be a hand widths apart was the best thing that we could do, rather than being 6 feet apart. But really, how do you implement that? So again, there's so many challenges with education in a refugee camp. I remember being in when we were walking through the refugee camp, when they're such wonderful people, they would come and invite you into their tents. And it was so sad because we went in the summer, and outside it was probably 100 degrees, and I do Fahrenheit, so I'm not sure what that is in Celsius. But when we would go into their homes, into these tents, it was hotter in the tents than outside. So we would end up just pooling back outside because it was just so hot in the place that they lived. So even these small things, like, when you have a fever and you're stuck in what feels like a sauna, how do you deal with that? The hydration issues, the dehydration issues, in fact. So there was so much that you had to think about when you were educating and kind of bending the rules a little bit. And then we were also able to pass out hygiene kits. So this contains soap, masks, body wipes, first aid kits. Again, you need access to water to be able to use some of these things. So those hand washing stations and some of the water that we provided was really helpful. Access to water was very helpful. So switching gears a little bit to training of health professionals, we were able to also set up a telemedicine program. And this was really cool because you're sitting in the middle of a refugee camp. How do you get Wi-Fi in a refugee camp? Our Wi-Fi was very spotty, but you did see some very tough cases, the doctors that that were working in the camp, the nurses that were working in our camp. So you have this picture where you have a doctor sitting in Salt Lake City, Utah, who is helping examine a patient. And then both doctors are able to come up with a treatment plan. And when the Wi-Fi was spotty, then the doctors spoke amongst themselves offline after they came out of the camp to be able to develop a treatment plan. So telemedicine was very big, and our doctors and nurses were able to train the doctors and nurses there, but more importantly, their doctor and nurses were able to tell us and train us on, this is what we have access to. We don't have access to a lot, so we need you to help us figure out what to do. So it's a program that's still going, and so it's very interesting how technology and education can help even in a refugee camp. So we also started a program with the host community in Bangladesh. And again, you're going to hear me talk about climate change a lot because it's the developing nations that are really going to be hit. I mean, we're seeing it in the US as well with these extreme weather, wildfires, tornadoes, things like that. But in developing nations, particularly, there's so many cyclones that are hitting. So in Bangladesh, a cyclone had hit in 2019. And so it internally displaced this huge community of Bangladesh host community members into a completely other side of the country. And what we were noticing when we were doing an assessment about how to help the host community was within this community, there were no doctors, there were no nurses, there were no midwives to deliver babies. What they relied upon were these women that just knew how to do it because they were, they were trained by their mothers and their grandmothers. And so we began a program. It was a maternity and birth center where it would give these women a safe space to be able to have their children. And again, we linked it with education. So we had antenatal and postnatal classes, we had infant classes, and this is something that we continue to do. So again, how do you manage signs of illness in your child? When do you need to come see us? When do you need to, get care? And where can you get care? Because of course, access to medicine is very difficult. And then, encouraging breastfeeding and things like that. So last weekend, there was a Med Global conference here in Chicago, and I was speaking to one of our board members. She's an OB-GYN. And 3 years ago, she went to Bangladesh, and she went there to do surgeries. And she was there for about a week or two. And she said, every day that I would walk in, I would hear another mother passed away. And then she said, I would walk in the next day and I would hear another mother passed away. And she was wondering, why is there so much maternal mortality? Like just within the week that she was there were women that were dying. So at the end of her surgery week, she said she brought the midwives together, and she said all they needed was a little bit of training on how to stop bleeding after a mother gives birth. And she said that's when the seed was planted in my head that I don't need to go to these countries to do surgeries. You don't need another doctor here. We just need to focus on training and education. And just in healthcare, particularly, when you train a midwife, for example, you save a life. When you train a nurse, you save a life. And so she had just come back 2 weeks before this conference, and she told me that she was able to. They did this whole, training and education program for the midwives. So this is how ideas are born in Med Global. It's because you have amazing doctors that go there, work, and then come up with ideas to say, this is what we don't need, and this is what we need. Okay, so switching gears to Yemen. Yemen is also one of our very, very big programs. We've been there since 2018 and been all over. Taiz, Hadramaut, Hodeidah, Aden, Sana'a. This is an area, as you all know, where there is famine and war. Since 2018, we've been able to serve about 2.7 million beneficiaries. We've supported 40 health facilities. And then, of course, that training and education component is huge for us. We have trained about 450 healthcare workers, and over 16,000 have received health education services. We were also awarded by the Ministry of Health here as one of the 5 best organizations operating in Yemen in the types of projects that we do and the quality of the projects that we do. And I think that education piece is the key piece. So here you have our pictures of our community health workers, our doctors, our nurses, who again talk about importance of breastfeeding, danger signs of pregnancy, hand washing is a big one, and reduction of infectious disease. There's a big focus on pediatrics, so our infant and child program. In a place where there is war and severe famine, you are concerned about, well, at least for the famine aspect, you're concerned about malnutrition. You have children that are dying, you have children that are starving to death. So showing them signs of how to prevent malnutrition, and how to identify signs of malnutrition in your child, and then linking them to nutrition centers. So there's a number of nutrition centers in Yemen. There's a lot of really great work being done there, but obviously it's never enough. And then, of course, we have the vaccination programs that awareness of immunizations and vaccination programs. So there was like a measles outbreak, polio outbreak, cholera, and then, of course, for COVID-19 as well. So our goals in Yemen were to ensure that we reduce disease. So that's what the health education component, the main goals of the health education component. We want these communities to be stronger, more productive communities. We want to be able to link them to have access to healthcare and medicine. And then we're actually measuring it with data. So we're doing surveys regularly. We monitor that by the number of health sessions that we've conducted, and then the rate of mortality in the area. All of this stuff takes a really long time to gather. So all of this information, so we're still in the process of gathering it to really understand our impact through our community health program. So Sudan is another country that we work in. We started in 2020 in COVID. As I mentioned, we built the largest oxygen generator, access to oxygen in South Sudan. But again, Sudan was hit with floods. Again, something that you're seeing with climate change. And so we were able to have our community health workers go out and talk about what happens in flooding. Well, what happened, the one most important thing is you get mosquito-borne diseases, you get waterborne diseases, and then you get diseases from fecal exposure and transmission. So again, teaching them, hand washing wherever you can, again, in the best way that you can, and then how to identify illness. Excuse me. There is also the Ethiopian refugee crisis that is happening in neighboring Ethiopia, where 2 million Ethiopians have been internally displaced because of the genocide that's happening there. So 70,000 refugees crossed over to Sudan. So we were able to provide primary health services and reproductive services to about 30,000 Ethiopian refugees. And again, linked to an education program where we were able to train about 30 health workers, because there was a lot of sexual health topics that were happening, because there was a lot of sexual violence that happened before the Ethiopian refugees crossed into Sudan. And so we were able to train our community health workers to deal with these very sensitive topics, as well as psychological training. So MedGlobal really likes to invest and train the trainer. Community health workers have, they may not have medical background, but then we train them to be able to do this work. Okay, 2 final things I want to talk about as far as education and training, because these are very close to my heart. The first is the Helping Babies Breathe program. This program was developed by the American Academy of Pediatrics here in the US. And this is a program that teaches you, whether you're a doctor, whether you're a nurse, a midwife, whether you're just a person who just happens to treat babies or treat mothers who are having babies. It teaches you what to do if a child is not breathing within the first minute of life, when they come out, if they are not breathing, this is what you do. So I brought this program to Pakistan through Med Global. It's a program that was already done in Pakistan, but we did it in kind of a different way. Because when I went to the rural areas of Pakistan, I noticed that, again, they didn't have the women that were delivering these babies did not have formal training, which is fine, but they were going on experience based on their mothers or what they were taught by their mothers or grandmothers. They were called lady health workers. So I thought, if we can teach the lady health workers what to do with these babies, then the infant mortality rate in Pakistan is one of the highest in the world. So we can try to, this has been proven to help with the infant mortality rate. So we were able to bring a team together of physicians and nurses to be able to provide training and education to many of the people that needed it there. We've also done this program in Yemen and Bangladesh as well. And then this is where technology and education comes in. So what you see on the left-hand side is an ultrasound probe. Now, when you think about an ultrasound, you think of a big bulky machine that you have to transport in different areas. Well, this technology made by Butterfly is an ultrasound probe that connects to any iPhone or iPad. So we donate the equipment to whichever area that we are training. And the woman in the picture on the right is the head of our ultrasound training program, Dr. Nahreen Ahmed. And we've done this program in about 6 countries so far, and it's been very effective. Is when you have an ultrasound, you can make very quick decisions in a very short time, and you're not carrying a huge piece of equipment around. So we've used this in the Bangladesh, in the Rohingya refugee camps. We've used this in Yemen, rural Yemen. We've used this in Gaza when they don't have access to much medical equipment at all. And most of the medical equipment in Gaza is very outdated. And in rural areas. So this small piece of technology can really change outcomes of a patient. So again, let's go back to the pregnant mother. If a pregnant mother is coming in and having complications, you put this ultrasound probe and right away you can know, does the fetus have a heartbeat? What is our next step in management? For COVID, this was a lifesaver because we were able to look at the lungs directly and see, is there fluid in the lungs? How bad does it, how bad are things looking? And then we're able to either provide more care or provide the care that we need in that moment. So this is how technology and education really help. So, I know that my presentation was kind of, I talked about educating refugees, I talked about educating healthcare workers, but in Med Global, the education and training piece is really the cornerstone of what we do. We don't just provide the medical care. We realize that that piece is critical, and we try to ensure that that is in every single one of our in every single one of our programs. As an educator, it's a very humbling experience going to these countries because, as you all know, as educators, you learn far more from your students than really what you give. And working with these communities, it has taught me life lessons of humility, compassion, resilience, strength, how much strength these people have. So it just reinforces the need for me to do this work and the need for the training and education piece. So I'm going to leave you with a quote that says, many of you have heard this: give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. I'm truly blessed and honored to be in the company of educators. Thank you so much for listening. If you would like more information on what Med Global does, please do visit our website. If you would like to donate, please do donate. 92% of your donation goes to our programs, and the other 8% goes to fundraising and admin. Thank you so much.